So diaphragmatic breathing. As I reference in the newsletter I just sent out, I think one of the most tricky things for a lot of people to access is the lateral expansion of the ribs. So for many, at least I find in my practice, they don't have much issue with the ribs coming forward or even with the upward motion. But the sides and actually the back expanding backwards is a challenge for people. This video, we're going to really focus on the lateral excursion of the ribs. So to start, what I want you to do is just close your eyes. And I want you to begin by just observing the movement of your rib cage when you breathe. Don't actively try to change anything. And the first thing I want you to do is I want you to ask yourself whether you can feel the ribs themselves moving. For some of you, it might be really easy to clue in. For others, you might find that you have no awareness or very little awareness of the rib cage moving. And then I want you to more specifically focus on the lateral expansion. And what we mean by that is the ribs moving out to the sides. And I want you to see if you're able to visualize or feel that. As you breathe in, the ribs should expand outwards to either side. And then as you breathe out, the ribs should fall back inwards towards your midline. Now what I want you to do is you're going to take your thumb and your forefinger and you're going to wrap your fingers around your ribs. I would like you to try to go a little bit higher up on the rib cage as opposed to right at the bottom. So if you feel to the sides, you should be able to feel your ribs, at least some portion of them. And you're trying to kind of get up to a point where you're kind of somewhere between the bottom of the ribs and your armpits, depending on your shoulders. And then what I want you to do once you're here is you drop your shoulders in your armpits. And what that's going to do is that's going to push the weight of your hands into your rib cage. We want you to feel some resistance from the hands. And now what you're going to do is you're going to actively breathe into that resistance. So we'll breathe in, feeling your ribs push up against the hands. And then as you breathe out, feel the pressure of the hands pushing the air out of your chest. And we keep going like that for a few breaths. You inhale, you breathe in, push into the ribs, push the ribs into the hands. And breathing out, you let the hands gently press the air back out. And we inhale, see if you can breathe more slowly. Somewhere around 4 to 6 seconds of an inhale. And then as you exhale, you allow the air to gently exit the lungs. Be a slight resistance to that press of the hands. Inhaling deeply. Feel the press. And exhale. Allow the hands to gently press inwards on the ribs as you breathe out. Now what I want you to do is I want you to now see if you can focus on the stretch of the ribs. We have muscles in between each rib called intercostal muscles. And they assist in our ability to breathe. As you breathe in, I want you to see if you can actually feel the stretch of the rib cage itself. And then as you breathe out, the ribs fall back inwards. And after doing this for a couple minutes like we've been doing, I want you to lower the hands and I want you to see if you can maintain that awareness of the outward expansion of the rib cage and the inward contraction of the ribs as you breathe out. And just keep doing this for a few more breaths. Inhaling, breathing out into the lateral aspects of your rib cage. And exhaling, allowing the ribs to fall back inwards towards your midline. Inhaling, expand out to the sides. And exhale, slowly falling back inwards. If your eyes are closed, I'd recommend opening them so that you can get a sense, breathing in, of the pace of the breath. And then we breathe out. We slowly control the exhalation. Inhaling, breathing in through the rib cage, expanding outwards. And exhale, drawing back inwards as you breathe out. And now relax. And I want you to just see if your awareness of your breath and your ribs has changed at all. Some of you may find that this exercise helps you to really clue yourself into the rib movement. For some, it may still be really difficult to feel your rib cage moving, and that doesn't mean that you've failed. You may just need a little bit more guidance and help, and that's actually pretty common. So hopefully this is helpful, and in the least, hopefully it gives you some insight into areas where you may need a little bit more help or attention with your breathing. So thank you.